This is Ellie, and I'm going to be doing my oral care plan. So I'm going to start with my chief complaint. My patient came in with left pinky toe pain. This was February 24th. She was told to let it rot by the podiatrist. And the next day they performed an angiogram of both of her legs through the right transfemoral approach. Our patient has severe lower extremity peripheral arterial disease with occlusions to the right and left superficial femoral arteries, as well as severe popliteal and infrapopliteal arterial disease in the left lower extremity and the right lower extremity. Her health history: she has hyperthyroidism, history of HIV, peripheral vascular disease, stroke, tachycardia, and history of tobacco use. She's had 8 cardiac stents, and my assessment is loading. Okay. She's alert and oriented ×4. She's very calm, cooperative, very nice lady. Her pupils were reacting, and she had very strong grip strength, both of her arms. She wears glasses, and she is hard of hearing, but she didn't have her hearing aids with her, so we had to speak very closely to her ear. Fall precautions weren't taken in place, so she had the side rails up, bed was in low position, bed wheels were locked, call light was within reach, bedside table was within reach. She was instructed to call the nurse for any assistance, and I checked on her multiple times, so made sure that she was good to go. Her skin color is within normal limits. Her skin was warm. She had good elasticity. Her skin was a little dry, but there was no breaks. Like, skin was very intact. She has full range of motion, both of her arms and her right leg. She couldn't move her left leg because of the angiogram that was done earlier that day, so she was on bed rest. Her gums are in good condition, teeth were in good condition, no swallowing problems. Her abdomen was soft, flat, non-tender, non-distended. She had her vowel sounds were active in all 4 quadrants. She has no incontinence of bowel or urine. She said she wasn't in any pain. Apical pulse was regular. Her left radial pulse on her arm was weak, and so was her right radial pulse on her arm as well. The left dorsalis pedis pulse, that was the one that we had to use a Doppler on, because I couldn't feel it and neither could my instructor, so we went to get a Doppler. We used it, we marked it, and we noted it that we had to use a Doppler, and we noted that we had to mark her where her pulse was. We also checked the right one as well, even though it was a little bit more palpable, but we still double checked with the Doppler as well. Her cap refill was less than 3 seconds. Her mucous membranes were moist. Her edema was +2 on her left foot. Her respiratory pattern was regular, even unlabored. She had clear breath sounds bilaterally. She was on room air. No cough, nothing like that. Her vitals, let me load the vitals here. Okay, so the first time I checked her vitals, her pulse was 70. Her temp was 97.4. Her respirations were 16. Her blood pressure was 110/67. and her O2 sat was 100. The next time I checked her pulse, about 3 hours later, her temp was still 97.4, her pulse was 78, respirations were 18, blood pressure was 116/57, and O2 sat was 100. Her labs, let's see. Okay. Her glucose was a little high. It was at 105. I'm assuming that was because when she first got there, she was in pain. So these labs were the most recent ones that I could find. Her red blood cell distribution width was 46.6. And I'm assuming that that's because of nutrient deficiency. Her MCHC was 31.6. She was anemic, so I put the result as anemic. Lymphocytes 41.8. Infection, and albumin 0.9 due to nephrotic syndrome, heart failure. Total protein 8.4 and due to dehydration. Her medications, she has ceftriaxone injectable. This one is to treat bacterial infections. She had cellulitis, so that's why it was given to her. So some side effects would be the pain at the IV site or phlebitis. Some major side effects would be seizures, submembranous colitis, allergic reactions, including anaphylaxis. Special monitoring. I would want to monitor the injection site for pain, swelling, or irritation. I would want to monitor for pseudomembranous colitis. The signs and symptoms for that would be diarrhea, abdominal pain, pus or mucus and stool, nausea, vomiting, heartburn, any allergic reactions, swelling, anything like that. Monitor for pulmonary complications like wheezing, tightness in the throat or chest. Monitor for skin reactions, rash, urticaria, and pruritus. The teaching, I would instruct the patient to notify any signs of superinfection, including black, furry overgrowth of tongue, vaginal itching or discharge, or loose, foul-smelling stools. Report any severe prolonged fever, skin problems, diarrhea, any signs of gallstones, which would be like pain in the abdomen, jaundice, chills, fever. Her next medication was clindamycin. Oh, for the ceftriaxone, she was getting 1 milligram IV every 24 hours. And the clindamycin, she's getting 900 milligrams IV every 8 hours. This one inhibits the protein synthesis, susceptible in bacteria. So again, I think this was given to her because she has cellulitis. Her side effects are diarrhea, C. diff, hypersensitivity reactions. So I want to assess the affected area at the beginning of and during therapy. I want to monitor for bowel elimination, diarrhea, abdominal cramping, fever, bloody stools, and assess for any allergic reactions like a skin rash, urticaria.